And we're ready to go. All right, it is the 24th day of October. Goodness sakes, beautiful day here in Minnesota. Sun is shining. We're supposed to get some rain this weekend, and the winter is on its way pretty soon. And the wonderful thing about living in the north, if for those who know that and experience that, is that we have these cold days to kill all the bugs. So if you don't like bugs, Minnesota, Wisconsin, Iowa, these are the places to live, because we definitely could get rid of those as soon as the frost hits. So I want to talk about people that are doing chemotherapy, because we have a number of people that are doing chemotherapy or considering doing chemotherapy, and there's some things to consider that we have discovered that can help people go through chemo much better. So on our website, we have a resources page on the website, and on that resources page is a blog. And on our blog, I'm posting updates on our blog constantly, so there's information on there just so you know. If you don't get enough information, you can go to the resources page and look at our blog on our website so you can see other articles. And there's a search feature on our blog now so that you can search a topic. So if you typed chemotherapy in there, you'll come up with the video that I created. And I shared it on this Facebook group many months ago when I created it, and helping people that are going through chemo and supporting those that are going through chemo. So please search for those information. Secondly, I want to tell you that the burden falls on you partly when you change anything. When you're going to decide to go through chemo, you're going to tell us, please, we care about you, we want to know, and we might have a solution for you. So we've had people start chemotherapy and not share that with the group, and I understand it's personal, you don't have to, but you got to share it with us, because we may have some solutions to help you go through this chemo much better. And it's proven to be helpful for a lot of people. So make sure you keep in touch with us with any changes in your care, anything you're doing differently, so that we can help support you through that. The video that we have on that page and the supporting document that goes with it looks something like this. Okay, this is actually a duplicate of that. The slide presentation, this keynote, is a duplicate of that's on there, but I changed it for this talk. But we used to give just a standard sheet here, natural support for patients doing chemotherapy with Connor's Clinic, and now we are tweaking this in a Word document and tweaking it individually for each patient. So when we talk to you, for instance, I just spoke to somebody earlier today that's going to do chemo. Well, then for that individual, we tweaked this Word document and gave it to them, so it's very personalized to them. It's not just these two supplements that we had them do. We had that person do one other thing, and we tweaked this a little bit specifically for them. So please contact us, set up a time to talk to myself or Michelle so that we could tweak your protocol on what we want to do for you going through chemo, because we found that fasting can really help going through chemo. Specific supplements can really help. Doing some very specific liver detox can help. Adding the foot bath therapy with the True Rife could be very helpful. And adding some other therapies that like PEMF and hyperthermia and things for those who are close to our clinic, or those who are close to a clinic that may have a PEMF or have availability somewhere near them that has some different therapies. That can be very beneficial. So we want to help you the best you can be helped. If you're going to do chemotherapy, we want the chemotherapy to be as targeted to the cancer as possible, and we want to support the rest of your cells so that you're not poisoned any more than you need to be from the chemotherapy. So make sure you contact us about that. We had another question that I wanted to address too, is if If there's any changes in your symptoms, also, you got an abrupt change in your symptoms that lasts more than a few days, because certainly just because you have cancer doesn't mean you can't get a little bug, or you can't have a cold, or pick up something else that you're dealing with. But you need to communicate that with us if you have any changes. That's, of course, we have a lot of people that are using the Facebook pages for that. We have a lot of people that are just more intimate in their thought processes, and they don't share things on the Facebook page. We'll make sure you communicate everything that's going on with yourselves with that. All right, so a couple other things I want to share, but first I want to open it up to questions on that. So I'm going to unmute everybody. Any questions?
My question is with the fasting. I'm really concerned because I'm already very weak. This is Sharon. I'm very weak, sluggish, lethargic as it is. And I get very nauseated when my stomach's empty. And
Yep.
I'm worried about going 24 hours without any food or energy. I just think I would be like literally, falling apart in a basket case. But
yeah, and that's why we need to tweak this to be individual. So for the person I spoke to this morning, to very similar situation, she's already very lower weight individual and can't really afford to lose any weight, and so we had to tweak that to make it more individual to that person. You still want to get the benefits of the fasting. Maybe we're just going to do a 12-hour fast prior to the chemo. And that's much easier to do, especially if you have the chemo in the morning, and that's what you might want to request. So some people have their chemo scheduled at 2 o'clock in the afternoon. Well, in the case of a situation like yours, Sharon, we may want to ask them if we could get the chemo at 9 o'clock in the morning, because then it's easier. You could still do a 15-hour fast if you stopped eating at 6 o'clock the night before. So, and you don't typically wake up in the middle of the night to eat. Most people don't, but and then it would be easier to get the chemo at 9 o'clock, go home, and then break your fast and start eating. So, would you get the same benefit as if you did a full day fast beforehand and then fasted the day of the chemo? Well, maybe not, but it could carry other side effects like feeling like you got the shakes and you're losing weight and you don't feel good either. So you have to kind of tailor that to each individual.
and then the other question is, after 48 hours, I know the most effectiveness of the chemo has already done its work, but I'm thinking if there's any trailing benefits,
there's always trailing benefits of the chemo. The idea is you want to just give major support to your liver detox pathways at that time. By taking milk thistle and doing the foot baths and doing everything that we're asking you to do to help detox your body, you're not going to be pulling the chemo out of the cancer itself. You're going to be pulling the chemo out of the rest of the body, where it's not doing its job on the chemo, or it's not doing its job on the cancer anymore because it's not there. So there's really no harm, in my opinion, that you're limiting the benefits of the chemo by really supporting detox pathways after 48 hours.
Okay, that makes sense.
Any other questions?
Dr. Yes, this is Liz Schaffner. How do you suggest that you best alkaline your body?
So
my husband read that salt in water, but I think that would raise your blood pressure.
Yeah, it can. So the best way to alkalize your body is by is by eating foods that have been known historically to help bring an alkaline, bring up your pH, which are basically your vegetables. So
Yeah.
juicing has been a great way to alkalize your body by juicing fresh organic vegetables and some fruits, some apple, but celery, carrot, beet. The negative of juicing is if your cancer is being driven mainly through glycolysis, you are spiking your glucose levels with juicing. So that's where I like the greens drink, as you're not going to get as high of glucose spike with that. And so that's your best way of alkalizing. If you have cancer in the stomach or in the small intestine, I know people have used baking soda, aluminum-free baking soda mixed with honey. There's some recipes on the internet. I don't have anything on our website or blog about that, but there's been some recipes where people have put their cancer in remission by mixing up baking soda and honey, or baking soda and maple syrup. I can't remember what they used. I think Manuka honey might be a good thing to mix it with, because if you just drink, if you put a tablespoon of baking soda in a glass of water and drink it, you'll probably throw up. It's pretty awful. I've tried it before, but it doesn't taste very good.
What would be the amount of baking soda?
Well, it's basically to tolerance. I think the recipe that I saw, I looked at that a couple years ago, I think, was they put maybe 2 tablespoons of baking soda and maybe equivalent of maple syrup. I think they use grade B maple syrup because grade B maple syrup has a little more nutrients than grade A does. But you could certainly use Manuka honey, I think would be the same theory. And I know the theory goes, well, you're mixing it up so that the baking soda and honey are together, so that when you eat it and absorb it, it will go, you'll draw the baking soda right to the cancer, because cancer likes that sugar of the honey or maple syrup. But in honesty, it doesn't actually work that way, because your body doesn't absorb the baking soda bonded to the glucose, so that's not how it works. But if you have a cancer in the stomach or in the small intestine, I think there's some validity to that. And remember, my opinion is, no matter, we're not measuring our pH through our urine and our saliva. You can't get an accurate tissue pH measurement doing that. So then how do you know if I'm alkaline or acid? You have to know that at the site of the cancer, you're going to be acidic, because the cancer itself, being in a state of rapid replication, is in a state of high metabolism and is going to give off a lot of waste, which is going to be acidic. So the cancer itself is creating acidity. So how do you alkaline? You change your diet, you eat better, you use the rife. Rife is one of the best ways to alkalize your body, because you're administering a frequency to the cancer itself, which is a photon carried on a wavelength. So there's going to be a donation of an electron, which that is, by definition, if you donate an electron to a molecule, you are raising the pH of it. So that's one of the best ways to alkalize. But I was just talking mainly dietary. But one of the best ways to alkalize is using a Rife machine. I really believe that's one of the ways that the Rife really helps a person heal. So and that affects the whole body too. So.
What about the foot baths? Can you increase them, or how often can you do them?
So you could do a foot bath. You could do a foot bath every day if you want. The foot bath. So the foot bath with the True Rife machine, you could do every day. Now there's other foot bath apparatuses out there that are called ion cleanses, and that works on a very different principle. The foot bath with the Rife is just another way to administer frequencies. The ion cleanses that are out there, and you might have gone to a clinic that used an ion cleanse, that is completely different. That is ionizing the water, positive or negative, and then pulling out the opposite ions. And that does pull a lot of electrolytes. And if you're going to do an ion cleanse foot bath every day, you can still do that every day, but then make sure you're getting greens drink in, or you're taking an extra mineral pill, because you don't want to just be pulling minerals out of your body.
Right. Do you, the ion, I use the Ion Pro Wave and the 3 detox programs, and I rotate them.
Yep, you're fine with that. You could do that every day.
I'm fine with that.
Yes.
Dr. Connors,
Uh-huh.
I was wondering about, I saw someone is looking at radiation, and sometimes because of the population of people I work with, they do get some burning and some localized pain. So there is a cream or something to help modify that. And then for bone pain, I recently had a patient that used over-the-counter Salon Pause and got great relief with just that localized hip pain from the radiation treatment. Is there anything you could comment on about that?
Can you post that on the Facebook page?
I will.
Yeah, post that product on the Facebook page. As far as the radiation burn on the skin, that can be very dangerous, not just because, so what's actually happening? What is radiation doing? Radiation works because it kills things. So you radiate cancer in a bone, and you can kill the cancer right there in the bone. But you're going to also go through the skin and the subcutaneous muscles and the subcutaneous fat layer and the ligaments and everything like that. So you're doing damage to that. One of the major side effects of post-radiation of breast cancer, because with breast cancer, one of the main things they do is, okay, we're going to do a lumpectomy and radiation and chemotherapy. Not an uncommon result is a person getting melanoma down the road because of the burn of the skin from the radiation. So there are some creams that you can use. One of the creams that I like to use, we use a cream that we make up in our office that's got curcumin in it. So the negative is in it, it's got curcumin in it, and it turns your skin orange because of the curcumin. But the curcumin is very healing to radiation damaged tissue. So a person could also be taking curcumin orally, but to put it right on the skin in a cream with a shea butter base that we use is very nice. But if it's over your face or something, you're going to have an orange spot on your cheek. But if it's over your breast or over a bone area, I think most of those people would mind having a little bit orange spot on their skin there from the curcumin, because it can be really healing.
Absolutely, and thank you.
And I forgot to address that other question of Liz's, whether you should do salt for pH balance. I know that Dr. Bob Marshall used to push pig salt for different things. You do have to be careful. I'm a big fan of using a good source of a sea salt, pig salt, a Himalayan salt, because it has other minerals in it. By definition, if you add minerals to something, you are going to raise the pH. But you also have to balance that out with, there is a percentage of people, and I went through this whole cardiology course a few years ago, and I can't remember what it is, that, but it's like 70 to 80% of the population will be reactive to salt, and their blood pressure will go up. So we don't want to be dealing with high blood pressure at the same time.
We're getting an echo.
So I hear that. So I'm going to mute everybody and unmute them here a second. Okay. All right. Any other questions?
Dr. Connors, when they tell you that your cancer is in your blood or and is depositing, what about the use of IV vitamin C?
Uh-huh. So I think the IV vitamin C is great even if the cancer isn't circulating in your blood. So IV vitamin C is a great therapy. It's just one that we, and we had a couple of comments of this on the Facebook page too, asking about IV vitamin C. I know some about IV vitamin C, but since we haven't really, we've kind of been forced to not do it in our office, partly because it is, it's slightly invasive. Now, today, as we talk at this time in 2018, we'd be able to add to that to our office without any issues. And we're actually looking at possibly doing that, adding it to our office. The problem in the past, I was so walking the gray area, especially when I had my chiropractic license, I was dragged in front of the board, I think 15 times, and accused of everything under the sun, and my license was threatened. I was always just like, okay, when is this next shoe going to drop and I'm going to be in jail? So I had to be very careful what I did. Now the atmosphere of alternative therapy and such and what we do has changed, and it has given us more of a green light to be doing more invasive things. And we have slowly added more and more therapies as we can afford to add them, things that I would want to do. IV vitamin C is one thing that that is, I think, is a great addition, is a great piece. So I think it's great. And Liz, I think that's something you should consider doing. There's not really a lot of downside. You do want to get a couple of things checked in your blood. So whoever's doing IV vitamin C will want to do a blood test and check your G6. I forgot what the test is that they want to check, but that's the only thing that they want to do, and make sure that you're safe doing it. But I think it's a great addition for anybody.
How often would you have to do it for it to even be effective?
Well, actually, there's some new data coming out that it used to be that we thought you had to get up to 50 to 75 grams a couple times a week, and now there's some new information coming out that you really don't need to go that high. 20 to 25 grams a couple times a week would be fine. And that would be a person who is kind of in the throes of their cancer. So someone who is more in a state of remission could do it just once a month. So it's not something you need to be continuing on a couple time a week basis for forever or anything like that either.
Dr. Connors, this is Deb Swartz. Before I came to see you, I was on high vitamin C, and I can't remember the dosage she used. But anyway, I couldn't have a port. So they were putting it in my elbows, my veins in the elbows. And like you said, it was invasive. The vitamin C totally dissolved my veins. It may have been the dose. I'm not sure. Maybe it might have been the type of vitamin C. Can you comment on that?
Yeah, it wasn't the type of vitamin C. It certainly the dose will affect your veins. So that's the other negative of probably the only really big negative of vitamin C is that it's ascorbic acid. So it's hard on your veins. If you're a bigger person like me, I probably wouldn't have any issue with it at all. If you're smaller like you, Deb, yeah, you could have issues with it. If you already have a port, then it's super easy. It's no big deal. You're not going to have that issue at all. But you're having to get a stick in a vein once or twice a week, and then you're having this IV drip. Now, I have known people that have said, hey, instead of having this drip in over an hour, I'll sit in a chair for 2 hours and do it. But of course, then you're dealing with just the finances of the clinic that you're going to and whether they're going to occupy that chair for 2 hours and have it go in slower and be more gentle on your arteries. But those are the things you just want to talk to with the clinic that you're going to. If you have a history of having difficult to find vessels for draws, for blood draws, then and you don't have a port, then you may want to think otherwise, that maybe this isn't the best thing for you. If you've been a person that's really easy to find your vessels and you have big veins and you never had a problem before, then you could try it. Also, I will say you can try it, and if you start to get an issue, you can back off or decrease the frequency and allow your veins to heal a little bit too. So, so again, it goes back to everybody's different, and you're going to have to see if it works for you.
And you said 20 to 25 grams? Is that what you said, the dose?
Well, most IV clinics right now start you at 20 to 25 grams, and their goal is to get up to 75. So, but I just heard someone speak who does this all the time, and he said that he had a bunch of data where it showed that 20 to 25 grams, you don't really need to go beyond that. There really isn't any added benefit beyond that. So that was his opinion. So that was interesting information. So, and you have to look at your body weight and such too. So you have to take that into consideration.
Okay, thank you.
Any other questions?
I guess I have one more. How about ozone in your vein, IV ozone?
So IV ozone can be really beneficial too. I see IV ozone more beneficial for possibly Lyme patients than for cancer patients, though I know some practitioners who think ozone is good for cancer as well. We had some patients do ozone injections at their cancer, and I was very optimistic that that was going to help, and it didn't seem to help at all. So I'm more than willing to try anything that isn't harmful for a patient. And my judgment on that is, would I do that myself? If I wouldn't do it myself, I guess I would try it on one of my patients. But if it's non-invasive, has no downsides, if it's worth, and there's some data that it could help, I certainly am not against trying something. Doing IV ozone, there's very little harm in it. There's any possibility with anything you do, but I don't think the chance of harm in that is near zero. So it's certainly worth a try. I'm just trying to wrap my head around the mechanism of action on it. But I think if anything, what IV ozone could be good for is to decrease inflammation, and that can be beneficial all around too. So
I think it was, well, for me, between the IV vitamin C and the ozone, it brought my circulating tumor cells down, because that's what they kept testing. Make sure that. Does that make sense?
I have not heard any data on that, but that's possible.
Okay, thank you.
Dr. Connors, this is Liz Schaffner. I have a port, so
so that'd be really easy for you.
that's right. But is there any problem with being on a chemo? I'll be taking chemo, a different type of chemo, once every month.
Okay, so in the old days, you used to say, if you're going to do a chemo is an oxidative agent. That's what a chemo is. It's a poison. So poisons are oxidating agents. That's how they work. You give a person enough poison, it oxidizes their cells, they stop working, and if enough cells stop working, you die. And vitamin C is an antioxidant. So one of the things that you say to a person is, if you're going to be doing chemotherapy, well, don't be doing vitamin C at the same time. You're kind of doing two opposite polar things here. You're giving a whole bunch of antioxidants at the same time as you're using oxidants. But what they're finding, and what the current belief system is that high dose vitamin C is oxidizing. It's not an antioxidant. So at least the current belief is that you could do high dose vitamin C while doing chemotherapy. You're not negating the effect of the chemotherapy. However, your oncologist might be living in kind of old world thought pattern there, and I didn't mean to say that in a negative way, but maybe thinking of it back, a few years ago, where it's an antioxidant, and he would probably be adamantly against you doing vitamin C because of that. And if it truly is an antioxidant, then you would agree with him, because while we're trying to poison you with an oxidant, we don't want you to unpoison yourself with vitamin C. But the current line of thinking is the reason why high dose vitamin C works is that it's basically an oxidizing agent. So I don't know how much supportive data is out there on research, so I can't point you to anything without doing a Google search myself on that. But that's at least the current line of thought with that. You may want to run that by your oncologist and see what he has to say about that.
Right, that's where my question was too. But thank you for addressing that, because you want to do as much as you can do to stop the cancer, but you don't want to kill yourself in the meantime.
Right, exactly. That's exactly right.
Okay. Thank you.
Absolutely. All right, so I am going to end our call here, and I am going to make another video soon, just to give you an update about me, to know, just for those who want to know what I'm doing and what's going on with me physically. If you don't know what I'm talking about, then you can watch that video. I'll post it in the next week or so up on the Facebook page, and I think it can be helpful to some people going through the path that they're going. So that's what we want, is to all be supporting each other through this journey. Any other questions before we sign off for the day?
Dr. Connors, I have one more advocacy thing to share.
Yeah.
I've had an appeal made to get increased chiropractic visits, and it was denied, of course, as experimental and some other crazy word. So I called the insurance company about the appeals process, because people often accept that's the end of the line. That's not true. The chiropractor I drafted the letter for him and did the research. So the chiropractor is going to be submitting a rebuttal letter and a reconsideration letter to the insurance company. And when they denied that, then there can be a doctor-to-doctor consult done with the insurance company's doctor, which I think he will do fabulous with that level. But just don't stop with the first denial is my input to that.
I'm pretty sure that insurance adjusters only have one rubber stamp, and it says denial. So it's kind of a game they play, and they just don't want to pay for anything that they don't have to pay for, and they pick the low-hanging fruit, which is alternative care. So that's
Correct.
We're in the situation we're in. So.
But of course, I'm a little persistent, and I'm not giving up with the first denial.
That's good. And it's, if nothing else, make their life a little miserable. Maybe they'll learn a lesson from it.
And that's what I hoped, and to help, because chiropractic is generally denied after you reach whatever your policy
Right.
authorizations are. So anyway, because I get lots of benefit because I get a pulse every time I'm there too weekly, which makes a world of difference.
Absolutely,
But
that's great.
so anyway, that's just a bit of advocacy for ourselves.
Well, thank you so much.
Dr.
All right.
Connors, this
Yes.
is Liz Duffner. I'm not going to take any more time, but I wanted to thank you very much. And I haven't researched it myself yet, but I wanted to sometime have you talk about stem cell.
Uh-huh. Yeah, I just read a book on stem cells just this weekend. So yeah, maybe next Zoom call I'll address stem cells and possible stem cell use with cancer. A number of my colleagues are doing stem cell. Currently, just in brief, stem cell therapy is, so we're talking about mesenchymal stem cells that are typically gathered from placenta or umbilical cord blood. So there's not really any use for fetal stem cells. Matter of fact, fetal stem cells, though there was this huge giant scream about it several years ago, remember, the
Right.
fetal stem cells cause cancer in people. So fetal stem cells are completely undifferentiated and have no stop mechanism. And even though there was people screaming and lobbying Congress and everything for use of fetal stem cells, all the fetal stem cell clinics have closed down, even overseas, because everybody that they use the fetal stem cells in develop tumors. They just have no stop mechanism because fetal tissue is supposed to be constantly replicating. Umbilical cord stem cells are the way to go for stem cell therapy today. Umbilical cord stem cells tend to be undifferentiated enough so it doesn't stimulate an immune response by the person you're injecting the stem cells in. And it has a stop mechanism so they don't form tumors. However, the real benefit of umbilical cord stem cells are in the field of orthopedics. So you have a bad knee and you're scheduled to get knee replacement surgery. My statement to you would be stop right now, go and get stem cell injections in your knee. I have maybe 50 colleagues that are doing this right now that were in my functional neurology on our functional neurology board. Now they're all into stem cell therapy, and the results are phenomenal. Like in 90% of the cases, people do not have to have knee replacement. So with joint issues, hip issues, even muscle issues, orthopedic conditions, it works fantastic. They're even using it in muscle issues with people with muscular dystrophy. There's new experimentation going on with use in late stage Lyme patients. There's some cases with Lyme patients that are real bad that are using it intravenously with some good results, and that brings a lot of hope to our Lyme patients that we have out there. It's not being used right now really with cancer patients, and but there's a lot of information that's available that we can talk about.
I will tell you, I just had that hip replacement in August, and it's been wonderful to be without pain. But I think the hip replacement, that major surgery like that, set my cancer. All the inflammation that had to do with it could have set my cancer on fire.
Well, it can, because how do you heal from a surgery? You heal from a wound. If you cut your hand, so if you take a knife and you cut your hand right now, normally your skin cells regenerate. I can't remember, I think on skin cells it's about every 6 weeks, your epithelial of your skin. But if I cut my hand right there and I have to wait 6 weeks for those skin cells to regenerate, I will bleed out and die. So when you have a wound, surgery, a cut, an injury, your body sends out growth factors. So your IGF-1 levels go through the roof in order to heal that wound, so that you can bring scar tissue to that area, the bleeding can stop, and you can heal that wound, and you can wound over and scar over and heal. So your mTOR pathway is upregulated. Remember what mTOR is? That's your growth pathway. So your growth pathway is highly upregulated. So depending upon how bad the damage is, so if I cut myself with a knife and a little bit of a cut and I hardly bleed and I put a little Band-Aid on it, I'm not going to really have much of an uptick of my mTOR pathway. But if I do major surgery, I'm going to have a huge uptick of my mTOR pathway. Well, that's not going to be discriminatory just to that wound site. It's going to be throughout my body, and that can increase the cancer growth. That's why I've said multiple times, multiple places, that I'm not a big fan of breast augmentation and reconstructive surgery post mastectomy, because you just got a debulking of that tumor with the breast removed, and allow that to heal. Well, that in itself was a surgery which upticked mTOR. Now you're going to do another surgery, and I understand I don't have breasts, and I am not one that I have the right to comment on what a woman feels like not having a breast, but you have to realize the risk of that other surgery. It's going to increase mTOR. So there's just those issues, and if I knew what I do now, Liz, talking to you a few months ago, I would have said go and do the stem cell injections into that hip and give that a chance before you do the surgery. We don't know. Maybe it wouldn't have worked, but we just got to.
I'd already destroyed the hip by prolonging it,
Sure.
for 8 years.
Sure.
8 years ago, I should have stem cell. Thank you very much for this Zoom call was a wealth of information in a lot of different places.
Oh, good.
Very beneficial.
Oh, that's great.
Does the stem cell work on your shoulder like a rotor cuff?
Absolutely. Yep.
Oh, great. Okay, thank you.
Yeah, works phenomenal for orthopedic conditions.
But not for bone cancer.
No.
Okay.
All right. Well, thank you very much. And we will talk very soon. Keep posting on Facebook, and we'll get your answers the best we know how. And always remember, we don't know everything. So sometimes the answer is going to be, I don't know, and I'll have to figure that out. So appreciate you guys so much. We appreciate the prayers that you give our clinic and for everybody here. And we cherish those more than anything. So we'll be praying for you and continuing this battle that we're all in. All right. Bye-bye,
Thank
everybody.
you.
Thank you, Dr. Connors.
Thank you.
Bye-bye.
Thanks, Dr. Connors.
Bye.